Thank you. The gentleman at this microphone has a question.
Senator Cardin, thank you. My question is, if we intend to provide health care services to an increased number of people, approximately 20% more people, without making any provisions to increase the number of providers, doctors, nurses, how can we rationalize that there will be no rate of rationing of services to more people if we don't provide more services?
Very good question. Let me thank you for that question, because you raise an extremely important point. We don't have the facilities today to take care of the extra numbers. I met with the president of Hopkins on this, and it's a serious issue. We have invested in these bills that are moving through significant improvements. We have doubled and tripled the federal contributions to qualified health centers. We have qualified health centers in the community here in Western Maryland. They provide primary care, dental care for a large number of people. We want to double the numbers of the qualified health centers. We need to train more physicians in primary health care. We don't have enough in primary health care. There's incentives in this bill to train more in primary health care. What we are going to be doing, and we also need to have just more personnel in primary care. What we want to do is have a transition period going from where we are today to the universal aspects of this bill in a reasonable time frame that allows us to have in place in the communities, the facilities, to deal with the increased numbers that are going to need attention through primary care.
Thank you. We'll move to the microphone over here for this gentleman.
You mentioned in your beginning statement that tort is a problem. I have two questions for you. One, would you be willing to go ahead and add amendments to the bill yourself to stop the tort problem? And the second question I have is, you said that we can't afford to continue going in the direction that we're going in healthcare because of the cost. It seems to me you just said we're adding more costs. Would you be willing to go ahead and add an amendment to the bill that says there is no funding for that?
I didn't get the second question, I'm sorry.
So that there is no money for funding for the health care bill. We're not going to have to pay for it, you told us.
Oh, no, it's going to be, let me answer this. As far as tort reform, that's an issue that we need to debate. There's a lot of ways you can move forward with tort reform. I was active in the Maryland legislature on it, and I'm fully prepared to be engaged in the debate, including, if necessary, to deal with amendments. We're not at that point yet. On your second point, on cost, this bill will be paid for. The president said it will be paid for primarily within the healthcare system itself. Let me give you one example. Let me just give you one example about how preventive care and wellness saves money. Safeway. We're all familiar with Safeway. It's a large supermarket chain in America. Has a program where their employees can voluntarily opt into a program that if they agree to take care of 4 of their health care needs, cardiac care by managing high blood pressure and cholesterol, diabetes and management to avoid amputation and kidney problems, obesity and managing weight and exercise, smoking and not smoking or going through a cessation program, agree to go through testing and monitoring. Safeway offers additional benefits to their employees, by the way, including health club membership, and they've been able to keep health care costs constant for 4 years. Prevention and wellness works. Better use of health information technology works. Hospitals have already agreed to reduce their Medicare rates if we get universal coverage, because they don't need to be reimbursed for uncompensated care. They are today.
That program,
We do. Well, in that respect, we want to make sure that the bill that we pass in Congress allows those types of services to be provided so that we keep people healthier and save health care costs.
Thank you. Gentleman at this microphone.
Good afternoon. Unlike most congressmen and senators, I've taken the time to read approximately half of the bill, line by line. From what I read, more became clear to me that this is really not about health care reform or insurance reform. It's a bill about government control. enterprise that is currently run by any government entity that was put out previously in private hands that is run more efficiently, at less cost, and with better quality.
Healthcare is a mixed issue between private insurance and public insurance, but it's operated by private doctors and hospitals. There are very few exceptions to that. In the reform, we want private doctors and private hospitals. We are not looking at trying to get employees of the government providing health care for our citizens. It'll be private doctors and hospitals. We're talking about how we pay for it. Now, again, there's going to be a fundamental difference here as to the responsibilities of government. I don't believe we should let private insurance companies have a free reign over what they can do. We saw what happened. Pre-existing conditions, they'll put restrictions on pre-existing conditions. If we don't put restrictions on how they can rate, they'll take you in and won't give you full coverage if you happen to have a child that has a rare disease. I think government needs to provide the protections so that the system will work.
Calm back down a little bit, please, so that we can hear